There are 270 systemic and ocular diseases that can be detected through an exam, through visualization of the tissue, the nerves, the veins, the arteries, the blood vessels. Through an eye exam, we can tell the precursors to a stroke, if there's damage from high blood pressure, glaucoma, diabetes. In fact, in 2017, the American Optometric Association did a study and found that there were 400,000 cases of diabetic retinopathy that were discovered in individuals that were not diagnosed with having diabetes. So that's 400,000 people that were able to get treatment for diabetes. If it wasn't for an eye exam, they would be walking around with it undiagnosed, with damage occurring to their systemic organs. Basically, that's what optometry is about. It's about protecting the public, about helping the public, and about providing good care to the eyes. But the eyes are not just a window into the soul, they're also a window into your systemic health.